They say magnesium glycinate helps you sleep better, eases muscle tension, and calms the nervous system. And for a lot of people, that's true. But nobody talks about what it can do to your body if you're not careful. Because this supplement, widely marketed as a gentle option, the safe choice, the one even sensitive people can tolerate, can cause real side effects, interact with medications in ways that create serious problems, and generate new health concerns while you're busy trying to fix old ones. Especially if you're over 60. Especially if you're already on medication. And especially if you started taking it because someone online said it was harmless. Magnesium glycinate has become one of the most popular supplements on the market, and not without reason. Magnesium is an essential mineral involved in over 300 biochemical reactions in the body: muscle contraction, nerve signaling, blood sugar regulation, blood pressure control, protein synthesis, and sleep regulation among them. Many older adults are genuinely deficient in magnesium, partly due to reduced dietary intake, and partly because certain common medications deplete it over time. The glycinate form, magnesium bound to the amino acid glycine, is better absorbed than many other forms, and is less likely to cause a digestive upset associated with magnesium oxide or magnesium citrate at equivalent doses. All of that is real. All of that is why it's popular. But popular does not mean without risk. Common does not mean harmless. And just because a supplement is available without a prescription doesn't mean your body has no limits around how much it can handle and under what circumstances. It still does. And this is where the conversation needs to go. The first problem most people encounter with magnesium glycinate is digestive, and it tends to arrive faster than expected. Diarrhea, nausea, stomach cramping, and general gastrointestinal discomfort are the most frequently reported side effects. And while magnesium glycinate is gentler on the digestive system than other forms, it is not immune to causing these issues, particularly at higher doses or in people whose digestive systems are already sensitive. Magnesium draws water into the intestines, which is the same mechanism that makes an effective treatment for constipation, but also the reason that too much produces loose stools and urgency that can range from inconvenient to genuinely disruptive. For seniors who already experience digestive sensitivity, who are managing inflammatory bowel conditions, or who simply have a gut that responds quickly and strongly to changes in supplement routine, magnesium glycinate can provoke a reaction that arrives with very little warning and takes days to settle after the dose is reduced or stopped. Calm mind, chaotic stomach. The two outcomes don't always come packaged separately. The second disadvantage is one that gets almost no attention in the casual supplement conversations happening online, and is potentially the most dangerous for older adults: the blood pressure effect. Magnesium is a natural vasodilator. It relaxes smooth muscle tissue, including the muscle in the walls of blood vessels, which causes those vessels to widen and blood pressure to drop. For people with hypertension, some degree of this effect can be beneficial, and magnesium's role in blood pressure regulation is part of why it's frequently recommended. But for seniors who are already taking antihypertensive medications, ACE inhibitors, beta blockers, calcium channel blockers, diuretics, adding magnesium glycinate on top of an existing blood pressure management regimen can push blood pressure lower than it should go. Hypotension in older adults is not a minor inconvenience. Low blood pressure in a senior means dizziness, loss of balance, and falls. The leading cause of serious injury and injury-related death in people over 65. Too relaxed, and your pressure crashes with it. That crash can happen on the way to the bathroom in the middle of the night, which is precisely when magnesium-promoted drowsiness is most likely to be present and most dangerous. Medication interactions represent the third, and perhaps most broadly significant concern, because magnesium doesn't just affect blood pressure drugs. It interacts with a surprisingly wide range of common medications in ways that can reduce their effectiveness when it matters most. Magnesium binds to certain antibiotics, particularly fluoroquinolones and tetracyclines, in the digestive tract, forming complexes that prevent the antibiotic from being properly absorbed. Take magnesium too close to your antibiotic dose, and you may be getting significantly less of medication into your bloodstream than your prescription intends. Bisphosphonates, the medications commonly prescribed for osteoporosis, including alendronate, are similarly affected, with magnesium reducing their absorption when the timing overlaps. Certain thyroid medications, some diabetes drugs, and various other compounds are also on the interaction list. The insidious part is that the interaction doesn't announce itself. The antibiotic still goes down. The osteoporosis medication still gets swallowed. Everything appears normal, but the drug is being quietly blocked from doing its job, and you have no way to know that's happening without understanding the interaction in advance. Helping one thing, quietly blocking another. And in the meantime, the condition the blocked medication was supposed to treat continues without the protection you thought you had. Drowsiness and daytime fatigue form the fourth disadvantage. And for the many people who take magnesium glycinate specifically to improve sleep, this one requires careful management of timing and dose. Magnesium promotes the production of GABA, a neurotransmitter that inhibits nerve activity and produces a relaxed, calm state that makes sleep easier to initiate and maintain. That's the mechanism behind the sleep benefit. But that same mechanism, at the wrong dose or taken at the wrong time, produces sedation that extends beyond the intended window. Too much magnesium glycinate, or a dose taken earlier in the evening than planned, can leave residual drowsiness the following morning, a grogginess that makes driving, balance, and clear thinking more difficult than they should be. For seniors already navigating the cognitive and physical challenges that come with age, adding a supplement-induced fog to the morning hours is a meaningful safety concern. You wanted rest, not a full shutdown that follows you into the next day. The fifth risk is the one with the most serious potential consequences, and it applies specifically to people with compromised kidney function, a group that includes a significant proportion of adults over 60, many of whom don't know their kidney function is reduced because it hasn't yet crossed the threshold that produces obvious symptoms. Healthy kidneys manage excess magnesium efficiently. They simply excrete what the body doesn't need. But when kidney function is impaired, that excretion mechanism is compromised, and magnesium can accumulate in the bloodstream to levels that become toxic. Hypermagnesemia, magnesium toxicity, produces symptoms ranging from muscle weakness and fatigue at lower excess levels to dangerously low blood pressure, irregular heartbeat, difficulty breathing, and in severe cases, cardiac arrest at higher ones. This is not a theoretical risk invented to frighten people away from supplements. It is a documented clinical reality in patients with renal impairment who consume magnesium beyond what their kidneys can eliminate. If your kidneys struggle, this becomes dangerous. And the frightening part is that many people supplementing magnesium glycinate have no idea their kidneys are anything less than fully functional. The sixth concern is magnesium overdose more broadly. Exceeding the body's tolerance through a combination of supplemental magnesium and dietary sources, or through dose escalation driven by the logic that if some is good, more must be better. Symptoms of excessive magnesium intake include irregular heartbeat, profound muscle weakness, confusion, slurred speech, and a blood pressure drop significant enough to cause loss of consciousness. These symptoms don't develop from a single slightly too high dose in a person with normal kidney function. The body has real capacity to manage excess magnesium before things become dangerous. But in someone with reduced kidney clearance, or someone combining high-dose supplements with magnesium-rich antacids or laxatives, the threshold can be crossed more easily than the supplement's gentle reputation suggests. Too much of a good thing still ruins everything. The gentleness of magnesium glycinate compared to other forms does not remove the ceiling. It just makes the ceiling slightly higher and slightly easier to approach without noticing. The people who need to exercise the most caution are seniors over 60, whose kidney function, blood pressure regulation, and medication complexity all make the risk profile of magnesium supplementation more complicated than it is for a healthy 30-year-old. People with kidney disease of any severity should not supplement magnesium without explicit guidance from a nephrologist or their primary care physician who knows their current GFR, their kidney filtration rate. Anyone taking multiple medications, blood pressure drugs, antibiotics, osteoporosis medications, thyroid hormones, diabetes medications, should have a pharmacist review potential interactions before adding magnesium glycinate to their daily routine. And anyone who has been self-dosing based on an online recommendation, a friend's experience, or a supplement label that suggests a range without knowing anything about their individual health context should pause and have that conversation with someone who does. Magnesium glycinate is not the enemy. For people who are genuinely deficient, who have confirmed that their kidneys are functioning adequately, who have reviewed interactions with their current medications, and who are taking an appropriate dose at an appropriate time. It can deliver real and meaningful benefits for sleep, muscle function, and overall well-being. The problem is not the supplement. The problem is blind trust. The assumption that because something is natural, it cannot harm you. The assumption that because millions of people take it, it must be safe for you specifically. The assumption that a supplement marketed as gentle has no ceiling and no contraindications worth checking. Even the gentlest supplements can turn on you when used carelessly, and the consequences of that carelessness in a senior managing existing health conditions and multiple medications can be far more serious than a bad night's sleep. Always know what you're putting into your body, not approximately, not based on a 30-second video claiming a supplement changed someone's life. Know your kidney function. Know your medication interactions. Know the dose that's appropriate for your weight, your age, your health history. Know when to take it and what to avoid combining it with. Your health is not a place for guesswork. It is a foundation everything else in your life is built on, and it deserves the same careful attention you would give to anything else that important. Supplements can be part of a smart health strategy, but smart is the operative word. Check before you swallow. Always subscribe for more honest, complete health information built for adults who want to make genuinely informed decisions. Share this with someone who's been taking supplements without the full picture. And like the video if it gave you something worth verifying before your next morning dose.